Did you know that diabetes and cholesterol are closely linked, creating a hidden risk to your heart and arteries? Cholesterol, a type of blood fat, is an integral part of cell membranes and is involved in the production of hormones. It is carried by lipoproteins, which come in two main types, HDL and LDL. While cholesterol is essential for overall health, imbalances in these lipids can lead to heart disease and stroke, especially in people with diabetes. Diabetes tends to lower HDL levels while raising LDL and triglycerides, a dangerous combination known as diabetic dyslipidemia. This condition accelerates atherosclerosis, the buildup of plaque in the arteries, and significantly increases the risk of heart attack and stroke. Research shows that diabetic dyslipidemia is closely linked to insulin resistance, a precursor to type 2 diabetes, atherosclerosis, and blood vessel damage. Sometimes it happens before diabetes is diagnosed. This means if you have diabetes or are at risk of diabetes, you shouldn't just monitor your blood glucose. Your total cholesterol to HDL ratio is just as important. Ignoring this connection could put your heart and arterial health at serious risk. But don't worry, understanding the link is the first step. Stay with us to learn how to stay in control and prevent cardiovascular disease. Here's why your total cholesterol to HDL ratio matters more than you think. Diabetes or atherosclerosis alone may not cause immediate harm, but the real danger lies in the long-term complications. These complications, such as heart attack, stroke, kidney failure, nerve damage, and vision loss, don't happen overnight. They develop silently, over years, often without noticeable symptoms until it's too late, which is why both patients and doctors need to focus on early detection, prevention, and management of risk factors. Doctors and researchers in the UK National Health Service, NHS, have been working hard to predict risk and prevent cardiovascular disease. They routinely collected data from thousands of general practitioners across the country and established the Q-Risk-3 model, a calculator to work out your risk of heart attack or stroke over the next 10 years, assuming you don't already have cardiovascular disease and are not taking statins. The Q-Risk model was launched in 2007, followed by Q-Risk-2 in 2008, which included additional factors such as ethnicity, type 2 diabetes, rheumatoid arthritis, atrial fibrillation, and chronic kidney disease. Since then, Q-Risk-2 has been updated annually. In 2017, Q-Risk-3 was published, incorporating established and new risk factors, an expanded definition of chronic kidney disease, stage 3, 4, or 5, migraine, corticosteroid use, SLE, atypical antipsychotic use, severe mental illness, erectile dysfunction, and a measure of blood pressure variability. Q-Risk-3, which provides a clear, personalized estimate of your absolute cardiovascular risk over the next 10 years, is used for people aged 25 to 84. It's particularly useful for people with diabetes or at risk of developing diabetes, as they are more likely to have elevated cholesterol levels, which accelerate the progression of heart disease and stroke. The National Institute for Health and Care Excellence, NICE, no longer sets strict cholesterol targets for people with diabetes. This means that when you visit your doctor, it's not enough to focus on your blood sugar and total cholesterol levels. Instead, it is better to understand indicators such as your total cholesterol to HDL ratio and Q-Risk-3 score. These numbers will help you understand why your doctor recommends certain treatments or how effective they are over time. Well, that was some useful information about diabetes and cholesterol. If you found this video helpful, please hit the like button and subscribe for more videos on diabetes, cardiovascular disease, and general well-being. Leave your questions and personal experiences in the comments below. We'd love to hear what you think. Thanks for watching. Stay strong, stay healthy, and we'll see you next time.